You ever get that pain in your gut and you can't quite describe it? Is it a dull ache, sharp cramp, maybe a weird burning feeling? It's something we've all been through, but man, it can be confusing. So today, we're going to decode those signals. We're going to learn the language your body is actually speaking.
So let's start with a little medical mystery. Picture this. A woman has this burning feeling in her abdomen, but when you ask her to point to it, she can't. It's vague, it's all over, she can't pinpoint it. So what's going on here? This isn't just some textbook question. This happens all the time. And by the time we're done here, you'll know exactly what this is.
To get to the bottom of this, we've got to think like detectives. See, in medicine, abdominal pain isn't just one thing. It's actually broken down into 4 really distinct types. And we can think of them as our 4 main suspects in this investigation. One of them is our culprit.
And here is our lineup. You've got visceral, parietal, somatic, and referred pain. Now, these might sound like fancy words, but they're just names for 4 very different feelings. The answer to our mystery? It's one of these 4. So let's start breaking them down.
All right, first up for interrogation, suspect number 1, visceral pain. Let's take a close look at its profile, its MO, and see if it matches the evidence from our little mystery. So what is visceral pain, really? Well, it all starts with your internal organs, your viscera. Like your stomach, your intestines. This pain kicks in when those hollow organs get stretched out or distended or they contract way too hard. And what's kind of weird is you often feel it more on the surface, not deep down inside.
Okay, now this is the part you really want to pay attention to. The key characteristics. Visceral pain is famously hard to pinpoint. It's vague, and the feelings associated with it, burning, aching, gnawing, cramping, does that sound a little familiar?
And boom, there it is. Case solved. That mystery pain from the beginning, that was a textbook case of visceral pain. The big clues, that burning feeling combined with the fact that it was impossible to localize. That combo points the finger directly at our first suspect. But hey, our investigation is not over yet. Understanding the others is just as important.
So let's check out the rest of the lineup. Because understanding parietal, somatic, and referred pain, well, that's what's really going to highlight what makes visceral pain so unique and why telling them apart is so crucial.
Okay, check this out. We've got visceral and parietal pains side by side, and you can see right away how different they are. Unlike that vague visceral pain, parietal pain is way easier to find. That's because it's from inflammation of the peritoneum. That's basically the lining of your abdominal wall. The result is a steady, aching pain that you can usually point right to. A totally different signature from our first guy.
Our next suspect is somatic pain. Now, this is another one that's super easy to pinpoint. Just think about the pain from a cut or when you pull a muscle. It's a deep, very well localized pain because it's triggering specific nerve paths right there in that spot. So the takeaway is simple. If you can point directly to it, it's almost definitely not visceral pain. All right, now for the most interesting, sometimes the most downright bizarre member of our lineup, referred pain. This one's the master of disguise. It's when the problem is in one place, but you feel the pain somewhere totally different.
I mean, look at this. This slide shows just how weird referred pain can get. This is a real thing, a clinical sign called Kehr's sign. A person could have a really serious, life-threatening injury to their spleen, which is in their abdomen, right? But the pain they feel is in the tip of their shoulder. How on earth is that even possible?
Well, it pretty much comes down to crossed wires. The nerves coming from an internal organ, like your spleen, share a pathway to the brain with nerves from another part of your body, like your shoulder. So the brain gets this distress signal, but it gets confused about where it's coming from, so it just makes you feel the pain in the location it knows better. In this case, the shoulder. Wild, right?
Okay, so we've met all 4 suspects. We've seen how they operate, what their calling cards are, and what makes each one totally unique. So let's put them all together for one final review.
This chart right here is the perfect cheat sheet. You've got visceral, vague, burning, crampy, hard to find. Then parietal, a steady ache you can point to from inflammation. Somatic, that deep, sharp pain from an injury. And finally, referred pain, the tricky one that shows up far away from the crime scene because of those shared nerve paths. Seeing it all laid out like this makes the differences crystal clear.
So, why does any of this matter? I mean, this isn't just for a pop quiz, right? This is about learning to speak your body's language a little more fluently.
And this right here is probably the most important takeaway of all. Just being able to tell your doctor, hey, it's a vague, burning pain I can't really point to, versus it's a sharp, steady pain right here, that is incredibly helpful. That description gives them a massive head start in figuring out what's going on. It's a tool for a better, faster diagnosis.
So the next time you feel that twinge or that ache deep inside, just listen a little closer. Pause for a second. Is it vague and burning, or is it sharp and localized? Because now you've got the code book. Now you can ask, what is my body trying to tell me?